gente pensaría que yo ya estoy de loca y que quién sabe con cuántos ya me he metido o así. Siento que sí, en ese aspecto sí le tengo un poco de miedo a mi mamá.
Es que da mucha pena hablar sobre esos temas.
Y más con nuestros papás, o sea, cuando yo le dije a mi mamá, sí fue como de, ¿por qué tienes eso? Y yo, a ver, o sea...
There are things happening in our bodies that we don't talk about. Inside the vagina, there's a living ecosystem, the vaginal microbiome. It's made up of beneficial bacteria, mainly lactobacilli, that protect and maintain balance. These bacteria regulate pH levels, creating an acidic environment that prevents infections. It's a natural defense system, but this balance is fragile. Stress, antibiotics, hormonal changes, or invasive products can disrupt it. When that happens, protective bacteria decrease, allowing harmful microorganisms to grow, leading to infections, discomfort, and pain. And yet, we don't talk about it. For many women, access to gynecological care is limited. Some feel ashamed or afraid of being judged, and others simply can't afford the expensive treatments. Understanding our bodies shouldn't be a privilege, because balance also means knowledge. This led us to ask, how might we help women better understand their intimate health without adding discomfort, invasiveness, or fear? Nuva was born from listening. Through interviews, testing, and user feedback, we identify 4 key needs: privacy, autonomy, comfort, and accessibility. Women wanted a solution they could use independently, in a private space, and on their own terms. Nuva is a disposable finger cut designed to collect a small external sample of vaginal discharge without insertion. Developed through ergonomic testing and user validation, it offers a simple, comfortable, and intuitive experience. At the tip of the device, there are 3 reactive membranes that analyze biomarkers related to vaginal health. The resulting color pattern acts as an early warning signal, helping users identify potential changes and encouraging timely medical consultation when needed. Nuva does not provide diagnosis or replace healthcare professionals. Its purpose is to help women recognize changes earlier and make informed decisions about their health.
Está padrísimo porque si tengo como alguna sospecha, pues ya no gasto en todo en el gine, sino digo, pues como una primera prueba, voy a la farmacia rápido, examino. Es como una alerta roja. O sea, lo siento como de que, pues el primer acercamiento y ya luego es como que, no manches, me sale algo aquí, güey, todo.
Es padre porque, o sea, no es invasivo y puede ayudarte a prevenir algo a futuro. Entonces no tienes que esperar hasta que te sientas incómoda, sino simplemente, pues voy a ver cómo así. Si compras una prueba de embarazo, ¿por qué no checas con eso?
During validation, users describe Nuva as private, accessible, and resourcing. Nuva aims to arrive sooner, before uncertainty, before embarrassment, before a woman decides to ignore what she is feeling. Nuva, designed by women for women. Early awareness, informed action.